My journey into professionalism. At least once a week, someone will ask me why I decided to choose nursing as my profession. I always answered with, I want to help people. As I stepped into this class for the very first time, I did not know what to expect. As I began learning about the professionalism needed for nursing, I began to learn things I may have not thought as deeply into. I learned about the importance of safety to the patient and nurse, conflict management between nurses and doctors, and cultural differences that need to be assessed when taking care of a patient. Although many like to think that nursing is a simple job where we assist the doctor and are kind to the patients, many do not realize how large this job really is. To be a nurse, you must be more than a doctor's helper. Although it is more than assuring the patient to be a professional nurse, one must first have the ability to talk and communicate according to patients. As a nurse, one must decide the best form of care for each individual. Patient-centered care is very important. It supports active involvement of each patient and their families in the decision process and allows our patients to feel important and cared for. We must give each patient individual care. As a nurse, we must advocate for our patients and promote wellness and healthy choices inside and outside the hospital. I have personally grown into a better understanding of team-based care and communication that I have a plan for development in. It is used to make sure communication is spread to everyone involved and to avoid mistakes that can occur due to a lack of communication. I will make sure to voice all my information to the doctor and other nurses who are caring for my patient. I will make sure to chart all my information and leave nothing out because one lack of information could cause harm to my patient. Safety is important in the hospital setting because if proper information is not voiced, a lot of harm can be done. This communication also allows my fellow colleagues and I to have a better relationship as well because we are working together and creating a better environment. With communication among staff comes some conflict. Conflict is in every workplace, but managing it correctly is very important. As a nurse, I must first look at the situation and decide a strategy that would best solve the situation, then self-assess myself to make sure I can best communicate the issue. Every situation and person is different, so handling the conflict may be different in certain circumstances. When a situation becomes difficult, the key to high cooperation and assertiveness is collaboration. Collaboration involves connecting with each party to understand their concerns, while also expressing my concerns in an effort to find a mutual and satisfactory solution. Conflict can occur with the patient as well, so knowing how to properly handle a situation to ensure cooperation on both ends is important. Conflict can occur when a patient has a cultural difference in the hospital, so finding a way to incorporate their beliefs and lifestyle is important. This can enable interprofessionalism and optimal outcomes for patient, staff, and organization. As we went through each step into professionalism, a main detail that needs to be incorporated when communicating any situation is the tone of voice and the words to communicate. To allow professionalism, I, as a nurse, must make sure the way I am speaking and communicating with my information to my fellow employees and patients is caring, compassionate, and informative. If I want my patients and employees to take me seriously, I must treat them with kindness and treat them as a partner. As I go through my nursing journey and begin heading to a clinical setting, I know that there will be challenges when communicating to each person, but as I continue learning and experiencing, it can be integrated into my future. This class thus far has taught me how to care for my patient by patient. Centered care, cultural competency, safety, and confidentiality. I also know how to better speak to my fellow employees by understanding conflict management, team-based care, and leadership. In class, I discovered that I am a type 2 person, which means I am more quiet and less likely to voice my opinions. So this helps me to understand how to communicate to people with similar personalities as me, as well as people with opposite personalities as myself. And I can better solve each problem depending on the character type. This class has also warned me about the hectic life in the hospital and how taking care of me first can allow better care to my patients and better communication with my team. Thanks to this class, I can head on to the next step, demonstrating high-level understanding of professional identity.
Your daddy, yeah, your stool's coming up short. What? Bilbo Baggins, I know you wish you had it, but you ain't though. Nope. We just crossed you over, broke your ankles. The realest